Welcome back, everyone. We're going to be going over Lab 2 for Biology 223. That is the axial skeleton, which will include the skull, the vertebra, the sternum, and the ribs. Throughout this video, we're going to be skipping a couple terms in every section just to leave some for you guys to be able to go and discover on your own. So just know if I skip certain terms in certain sections, we're doing that on purpose, but I'm hoping that I can go over a lot of the more difficult terms and definitely some of the most missed for you guys. So we're going to skip the sutures. It's pretty easy, it's something that you guys can definitely discover on your own. We're going to start with the frontal bone. First term in the frontal bone is the frontal sinus. We have a very specific model to denote the sinuses. And it's this one. It's a cross section of a skull, and it has all these little red polka dots in them. So for example, this right here on the frontal bone is going to be the frontal sinus. A sinus is just kind of like a big space. Some of you might have had like sinus headaches before, and doctors usually push on your forehead or on your cheeks to relieve some of that pressure and get some of that fluid to drain out of there. So this is going to be that frontal sinus right here. There's a couple more sinuses we're not going to talk about explicitly in this video, but just know that they are there, and they are usually tested on this model. Otherwise, for the frontal bone, we're going to talk about the supraorbital margin and foramen. Supraorbital margin is this kind of bumpy process, basically just where you would imagine your eyebrows would be. That's going to be the supraorbital margin. And you can kind of see it right here. There's a little hole right here, like this little divot. That's going to be the supraorbital foramen or notch. And don't forget that a foramen is an opening. Make sure you guys are very familiar with those definitions on the first page. It's going to help a lot for this section. Moving on to the parietal bone, we're going to take the skull and we're going to flip it around. The parietal bones just on either side. We don't really have like specific terms for the parietal bone, so just know that these two halves on either side are going to be the parietal bone. And now the occipital bone. The occipital bone has a couple different things going on with it, and for that I'm going to take the top part of the skull off. We have external and internal occipital protuberances. The external protuberance is right here. Internal protuberance is going to be inside here. The crests, internal and external, both dive anteriorly to the protuberances, so I'll let you figure that out in lab on your own, along with the occipital condyles. The foramen magnum is this giant opening at the bottom of the skull. This is where the spinal cord is going to run through, and that is a passageway or opening because, again, it is a foramen. Next is the jugular foramen. I usually tell my students that the jugular foramen is jagged. Most of the foramen that you see on this side of the skull are pretty circular, maybe a little ovalish. This one is incredibly jagged, and you can find it just anteriorly to the occipital condyles, and that's something you can definitely look for yourself in lab. And then the hypoglossal canal is an opening that runs through the occipital condyle. So what that pointer is sticking through right now in that condyle is going to be the hypoglossal canal. So if you need to find that, just look for the opening on the inside of the condyles. Next we're going to go over is the temporal bone, much more involved bone, I guess. We're going to start with this section right here. It almost always is most missed for my students for every quiz and every practical. We're going to talk about this zygomatic arch real quick. So this overall arch altogether is called the zygomatic arch because up here your cheekbone is called your zygomatic bone. But we have to know a couple processes for it, starting with the zygomatic process of temporal bone. You will also need to know the temporal process of the zygomatic bone. What that looks like is a process is a projection. Starting at the temporal bone, we have this little process right here. That's going to be called the zygomatic process of temporal bone because temporal bone is where we're originating. So this is the zygomatic process of the temporal bone. This entire thing is the zygomatic arch. And then over here on the zygomatic bone, we're going to have the temporal process of the zygomatic bone. So of zygomatic bone, because that's where we're originating, and this is a projection, so it's going to be the temporal process or projection of the zygomatic bone. So make sure you don't get that twisted. It's really confusing and students almost always miss it, but I feel confident you guys can get that. Next we're going to go over is the mandibular fossa. I like testing that one on this model because when you fit your mandible in there and you take it off, you can see there's these little gel-like pieces that holds the mandible in. That is going to be the mandibular fossa. A fossa is a depression, so it's just going to be where the mandible fits, and again on this model it has these little jelly-like things that allow the mandible to kind of just chill in there. So that's the mandibular fossa. Next is the mastoid process. If you look at the side of the skull, you can see there's a bump kind of coming outside on the posterior end of the temporal bone. That's going to be the mastoid process. Just medially and anteriorly to that, we have this pointed like projection you guys can kind of see right here. It kind of comes to a point right there. That is going to be the styloid process of the temporal bone. You need to make sure you include of temporal bone because you are going to learn multiple styloid processes in the body. I like to remember this one like styloid stiletto. It's like it comes to a point kind of like a stiletto. That's usually how we teach students. So that's the styloid process of temporal bone. Next, we're going to go over the squamous and petrous part. Next to squamous part, I would just write valleys. Next to petrous part, I would write mountains. We usually look on the inside of the skull for this one. The petrous part of the temporal bone is this rough ridge-like. Kind of looks like the mountain of the temporal bone. And then on either side, we have these smoother portions. That's what we call the squamous part. So you can see we have these soft portions on either side of this crest. That mountain is going to be the petrous part of temporal bone. And that valley, softer parts, are going to be the squamous part of temporal bone. Next one and the last one we're going to go over for the temporal bone is the temporal fossa. A fossa is a depression, and that's just this little small depression just above that zygomatic arch. This is usually where people kind of think of like your temples. So people like massage their temples when they have a headache. That's usually where you're hitting is that temporal fossa. The skull's kind of weak in this area, and that's why people usually say like the temple is a sensitive part of the body. So just kind of cool little fun fact. The next few terms, we're going to ask that you guys figure those out on your own. They all are related to the temporal bone, and they all are some type of opening or canal. So go ahead and take some time to figure that out on your own using some help from the pictures in your book or figure it out in lab. Next, we're going to be going over the sphenoid bone. We almost always test that disarticulated. What that means is we have a sphenoid bone that we have taken out of the skull that you can see. Normally, it would rest right there in the middle. You can kind of almost see how it would sit right there in the center of the skull, but we almost always test it taken out because it's a little bit easier. For this one, this gets really confusing with a couple of these terms, so pay attention closely. When we're testing the sphenoid bone, we have three separate terms that are all almost in the exact same area. We have the body of the sphenoid, the sella turcica, and the hypophyseal fossa. How I always test my students is the body of the sphenoid is everything that I currently have my thumb and forefinger wrapped around. So it's just all this in the middle, kind of looping around, and then you can think of like this stuff on the outside would be like the wings. So this is the body of it. Next term is the sella turcica. It literally translates to Turkish saddle because if you were sitting on this bone, kind of like you were riding a bat, you would sit right here in this saddle. So this part right here is going to be the sella turcica. Next is the hypophyseal fossa, and that's a depression. Right here in the middle of the sella turcica is going to be this depression that is the hypophyseal fossa. So make sure you guys have those terms very clear in your mind. All this is the body of the sphenoid. This saddle right here where you would sit if you were riding this like it was a bat, you would be sitting in that Turkish saddle, but that depression is going to be the hypophyseal fossa. So I usually test body of sphenoid as a region, sella turcica as a structure, and hypophyseal fossa is a depression. Next we have greater and lesser wings. Greater wings are just these big fat wings on either side, kind of like you would be riding a bat. Those are the wings that are going to be flying. Your lesser wings are going to be the little handlebars. So if you were sitting in your Turkish saddle and you were holding on to the bat, these little wings right here would be the handlebars. Those are the lesser wings. And then the pterygoid processes are going to be on the inferior end. It's these two projections right here. Again, processes is a projection, and it's kind of like where the bat would land if it were to land, or kind of like what its legs would be. So that's all we're going to go over for the sphenoid bone. Next we're going to go over is a little bit of the ethmoid bone. The ethmoid bone is going to be more anterior to the sphenoid bone. It's kind of behind the temporal bone, and you can see kind of a piece of it right here. The cribriform plate is going to be this plate you can see on the inside of the ethmoid bone. It has a bunch of holes in it, and those are going to be your olfactory foramina. So foramina, again, is an opening in this cribriform plate. You're going to have a bunch of holes. That's where all your olfactory nerves are going to be diving into your nose. And you have your crista galli. There's this little crest in the ethmoid bone. You can kind of see it right here. Kind of dips up. That's going to be the crista galli. Your conchae and your perpendicular plate you guys can discover on your own. Most of our models do not show the superior conchae very well, so you can look those up in your book or on a very specific model that we have. Next, we're going to go over the little bit of the maxilla or maxillary bones. First, we have the orbital rim. This is this ridge at the bottom of the eye socket. So kind of like we had the supraorbital margin earlier, we have the orbital rim just kind of underneath that eye socket. We have the anterior nasal spine. Just at the bottom of the nose, you can see it kind of comes to a point right there. That's going to be the anterior nasal spine. Your alveolar processes are going to be all these little projections that are right above your teeth. Your palatine processes, we're going to look on the inside of the mouth, would be all this just behind your teeth. And then the rest we're going to leave you to work on in lab. Next is going to be the mandible. You have your body of your mandible. That's just all this section where the teeth are. And then you have your ramus of the mandible. So this part that dips up. We usually say the body of the mandible is the horizontal section. The ramus of the mandible is the vertical section. You have a mental protuberance. That's just kind of what you'd imagine like your chin would be. A protuberance is kind of just like a more wide projection, so where your chin is. You have two processes that we're concerned about, your condylar and your coronoid process. Coronoid comes first. It's the more anterior of the two processes, and the condylar process is more posterior. It's kind of a little wider. And then one more term we're going to go over real quick on this one is our mandibular notch. That's this notch in between each of those two processes. So when I test my students, I usually either point here and say, name this, coronoid process, point here, name this, condylar process, or I'll kind of like seesaw the pointer and say, tell me what this is, and that would be the mandibular notch. All those other terms on the next page, like the lacrimal bones, conchae, vomer, all that stuff, we've kind of already gone over a little bit, so we're going to ask that you guys do that on your own. We're now going to move on to talking about the vertebra. We have a couple different sets of vertebra that we are going to ask that you are able to distinguish in lab, so pay attention closely. Right here we have a set of 3 vertebra. We have the lumbar vertebra, we have a thoracic vertebra, and we have a cervical vertebra. Cervical is the smallest, thoracic is the middle, lumbar is the biggest. Lumbar vertebrae are at the bottom of our spinal cord, so hopefully it makes sense that we'd want those to be a little bit bigger to support all the vertebrae that are on top of it. And we're going to use the lumbar vertebra as an example for a lot of the generic terms that we're about to learn. So you have the vertebral body, that's just this biggest part of it. You have the vertebral foramen, it's this hole going through the middle, this is where the spinal cord will run through. Whenever you stack several vertebrae on top of each other and then run a pointer through all of them, just like so, that is no longer a vertebral foramen, it is now a vertebral canal. So make sure you guys are careful with that. Whenever we stack them on top of each other and ask you to name this kind of wider, longer passageway, that's going to be a vertebral canal versus a singular vertebra, that's just going to be a vertebral foramen. Next is a vertebral arch. Vertebral arch and vertebral body I usually test as regions. So vertebral body is everything from here down, and then an arch is everything from here up. So you can see it kind of is a little bit of an arch. Next, for pedicle and vertebra, we like to liken the vertebra to a house. So maybe like the body is the basement, your pedicles are going to be your walls, and your lamina are going to be your roof of your house. Next, we have spinous processes and transverse process of vertebra. Coming off on the posterior end is going to be our spinous process. If you feel your back and you feel that bump in each of your vertebrae, what you're feeling is likely the transverse or the spinous process. That's the spiny process that pokes out into the back, and we have our transverse processes out here on the side. Next couple terms we're going to go over real quick. We're going to look at the vertebra from the side, just like so. You can see the superior articular process superiorly, and the inferior articular process pointing down. The rest of the terms we're going to ask that you find on your own. It's not too many difficult ones, and you guys can work with your TAs and DAs and lab mates to figure it out. We are going to spend a second talking about the atlas and the axis, though. It's these two special vertebrae. We have C1 and C2. Your atlas is C1, and your axis is C2, and they sit on each other just like so. TAs will often test you guys on these, asking you to name what each of these are. The easiest way to distinguish the two is this projection right here. So we call this pointy part right here the dens of the axis. And you can see these vertebrae look pretty different. One does not have a dens. That's how you know that that is going to be the atlas versus the axis, is because of the dens right there. So make sure you guys take some time and look at those when you're in lab so you don't get confused on them. The next couple sections in your book are talking about the vertebra, like between cervical, thoracic, and lumbar, and all the special things that go on in those. So make sure you take a minute to go over those on your own. Next, we're going to talk about the sacrum real quick. This is at the bottom of your vertebra. This is what you'd imagine your tailbone would be like. We have two different regions of the sacrum. We have the base of the sacrum on top and the apex of the sacrum on the bottom. So those are going to be tested as regions. You guys will learn in anatomy that an apex is really just any region where something comes to a point. You'll eventually learn like an apex of your lungs, apex of your heart, all that good stuff. So know that those are going to be tested as regions. We have a sacral canal. That's going to be this canal that runs through the sacrum. We have the median sacral crest. If you guys look at the sacrum from this side, I always kind of think that these crests kind of look like what you'd imagine like a dinosaur's back to look like, or maybe a camel. These ridges are going to be the median sacral crest. And then the sacral hiatus is going to be the bottom of that ridge. Looking at the sacrum from the posterior end, you guys can see there's 8 foramina running through all of them. Those are going to be our sacral foramina. The rest of the terms we're going to ask that you go over on your own. They're not too difficult. The sacrum is usually pretty easy for a lot of students to understand, so take some time to look at those in lab. And we're going to finish off the day by talking about a rib. So in my hands I have a rib. This section right here, you can see it kind of comes to a point that I'm tracing with my thumb. That's going to be the head of the rib. Just underneath, it thins out a little bit. That's what we call the neck of the rib. All this, the rest of it, is just going to be the body of the rib. And then just to the side of the head, if you look underneath, there's a little bump right here. That's going to be the tubercle of the rib. A tubercle is kind of like a projection, or more just like a pointed process. So make sure you're familiar with those definitions again. And then the last term is going to be the costal groove. There's a small groove just to the side of that tubercle of rib. That's going to be our costal groove. We're going to take a second and think about left versus right for ribs. Next week, when you're going over the appendicular skeleton, you're going to be frequently asked to identify whether a bone is a left versus right. So we'll start that conversation now with the rib. When you're looking at a rib, you always want your head of your rib to be posterior. That is going to be what connects with our vertebra, just like so. So that's a good way to start identifying a left versus right rib. After that, you want to make sure the costal groove is pointing down or inferiorly. So once you identify the head and the costal groove, you should be able to identify a left versus right rib. And I currently have a left rib in my hands because right now I have the head posteriorly, the costal groove is pointing downwards, and so it would fit on the left side. All right, good luck in your guys' section this week. If there's any terms I did not go over,